This is table number 8, and today we are going to discuss about trapezius muscle. This is trapezius muscle. It has origin from external occipital protuberance and superior nuchal lines, ligamentum nuchae, spine of C7, and T1 to T12. It has insertions on the upper fibers insert on the posterior border of clavicle on the lateral 1/3 part, and the middle fibers insert on the medial border of acromion process and upper lip of crest of spine of scapula. The lower fibers insert on the deltoid tuberosity of scapula. The functions of the fibers of trapezius muscle are: the upper fibers are responsible for elevation of scapula. The middle fibers are responsible for the retraction of scapula. The lower fibers are responsible for the depression of the scapula. The lower and upper fibers together are responsible for the abduction of scapula above 90 degrees. This trapezius muscle is supplied by spinal accessory nerve and branches of C3 and C4.
The deltoid muscle is made up of 3 fibers: the anterior fibers, the middle fibers, and the posterior fibers. The anterior fibers originate from the lateral 1/3 of the clavicle. The middle fibers originate from the lateral border of the acromion, and the posterior fibers originate from the lower lip of the crest of the spine. All the 3 fibers are inserted on the deltoid tuberosity of the humerus. It is innervated by the axillary nerve. The action of the anterior fibers is flexion and medial rotation of the arm. The action of the posterior fibers is extension and lateral rotation of the arm, and the action of the middle fibers is abduction of the arm up to 90 degrees.
This is levator scapulae. It originates from the transverse process of C1 to C4, and it inserts on the medial border of the scapula between the superior angle and the root of the spine. Nerves supplied to the levator scapulae is by the C3 and C4 spinal nerves, and as well as the dorsal scapular nerve. Its action is it helps in the elevation of the scapula as well as the medial rotation of the scapula. The next muscle is the rhomboides minor, which originates from the lower 1/3 of the ligamentum nuchae as well as the C7 and T1 spine. It is inserted on the medial border of the scapula towards the root of the spine. It is supplied by the dorsal scapular nerve and helps in the retraction of the scapula. This muscle is the rhomboides major, which originates from the T2 to T5 spine, and it is inserted along the medial border of the scapula between the root of the spine and the inferior angle. It is supplied by the dorsal scapular nerve, and action is retraction of the scapula. This is teres minor muscle, which originates from the upper 2/3 of the dorsal aspect of the lateral border of the scapula, and it is inserted on the inferior facet of the greater tubercle of the humerus. It is supplied by the axillary nerve, and it helps in the lateral rotation of the arm. This is the teres major muscle, which originates from the lower 1/3 of the dorsal aspect of the scapula as well as the inferior angle of the scapula. It is inserted towards the medial lip of the intertubercle sulcus of the humerus, and it is supplied by the lower subscapular nerve and helps in the medial rotation and the adduction of the arm.
This is latissimus dorsi, and this is originates from the T7 to T12 spines of vertebrae and thoracolumbar fascia and iliac crest and inferior angle of the spines, and it is insertion on the intertubercle groove of humerus or biceps groove, and it's supplied by the nerve called thoracodorsal nerve or nerve to latissimus dorsi, and its action is adduction and extension and medial rotation of the arm, and brings the body towards the arm while climbing.